What number, facing down, what number do horses walk on?
3.
Yeah, that's going to be 3. So facing down, facing down. This Hamilton stuff keeps flipping us off. No. Facing down, facing down. All right, so what part of my pelvis are my hands on right now? My ilium, I or E? I, the sassy bone. What part are you sitting on right now?
Tailbone?
That's going to be part of your axial skeleton.
Your ischium.
Your ischium. Your ischiums, your titium. And then the pubis. Ilium, ischium, pubis. All right, now this bone, the femur, this bone, my patella, this more slender, yeah, fib, you. Remember we tell a little what? Little fib to who? To you. The more robust bone in the front, tibia, tarsus, metatarsus. I'm wiggling my toes, you can't see it. Phalanges. Very nice. All right, so now let's talk a little bit about joints. Tell me the medical term for joint. That's a type of joint. Arthro. Arthro is the medical term for joint. Joint is just simply where 2 or more bones come together. Now we've got a bunch of different types of joints, and they are going to be classified by how much movement do they allow. I have some joints, like in my skull, that don't allow any movement. They're sutured together. They don't allow any movement at all. I have some joints that allow a little bit of movement. I have one of those in my lower jaw. I also have one of them in my pelvis. And then I have some joints that allow free movement. Interpretive dance joints. Joints are going to contain a joint capsule. Now these joint capsules are going to be found in our freely movable joints. These joint capsules, right, consider myself like the Tin Man, and I need to oil the joints in order to move properly. I produce my own oil. In fact, the oil is called, Lexi just said it, synovial fluid. And this is where somebody at the round table of naming crap in your body was like, let's give them a break. So inside this joint capsule, I have a membrane called the synovial membrane. The synovial membrane creates synovial fluid. Synovial fluid lubricates the synovial space. And the joints are referred to as synovial joints. Huzzah. Whoever that guy was, thank you. So that's going to lubricate the surface. And then we've got these other little like shock absorbers, like the bursa. You get, what would it be if I had inflammation of my bursa? Bursitis. Would it be if I have inflammation of this joint? And yeah, any joint would be arthritis. So those are the basics behind our joints. Yeah. It says, let's see. Together with joint CV state condition, I'm not sure. Both joint, 2, twice, joint, CV state or condition, plural. No idea.
Combining something from CD, combining.
I don't know. I don't know what that means because there are no blanks that fit that. All right, so we do have some fancy names that we need to talk about. We have the three types of joints. We have no movement, a little bit of movement, free movement. Each of these has their own fancy name. No movement is synarthrosis. No movement in the joint, condition of. Synarthrosis means a condition of no movement in the joint. An example of this would be in the skull. We can see in the skull these little crackly lines right here that are fusing the areas of the occipital with the parietal, with the temporal, frontal, facial. These don't have any movement. Once they have sutured, they form a fibrous joint, and they don't have any movement. It would be pretty bad if they did. Because I don't really want to, push on my forehead and have all the bones go, I need them to come together. But they also don't form these fibrous joints until adolescence, until you're finished growing. Because once these joints have sealed, they're done. If they seal before the brain has finished growing, you're in a bit of trouble because now there's no space for your brain to grow. And it's going to continue to grow and start pushing on that sealed bone. So kind of important that your body knows when to form these fibrous joints and when to let them continue to grow. Amphiarthrosis. Amphiarthrosis allows for a little bit of movement. I have here in a mandible, we've actually fractured the mandible at this amphiarthrosis joint. Put that together like that. So here I have the amphiarthrosis joint, and it only allows a little bit of give. The reason for this is if I bite on something hard, I need there to be a little bit of give so I don't break my jaw. This is the joint that we often see broken in cats. Cats suffer from a condition, well, it's not technically a condition, we kind of made up a name for it. We call it high-rise syndrome. And what high-rise syndrome is you live in an apartment on an upper floor, kitty's out on the patio, sees a bird, sees a squirrel, pew, takes a header off the porch. They usually will land, but they'll clack their jaw when they land. The same injury common in automobile accidents. When you clack your teeth together super, super hard, you can break that symphysis right there. And then we'll have to go in and do a stainless steel suture and fix it back together. Not a great story, but a story about a time when Miss Huff, well, she kind of messed up. Didn't technically mess up, it was the dog and the owner that messed up. So they are in dental disease, very easy to break. So when you guys are going forward and learning in special topics, in your surgery classes, as you are going through the program, we're going to teach you how to do dental prophylaxis. You clean dog and cat teeth just like the dentist does to you. Procedure is exactly the same. One of the things that we see when we have progressed dental disease is it can affect this joint, making it very loose. Had a chihuahua that had come in We'd never seen it before, but it had come in for a dental. It was an older Chihuahua, and oh my goodness, the dental disease on this dog was insane. It had like pus dripping out of its mouth. So the owner drops it off because it is a surgical procedure, right? We have to anesthetize the animal. I'm not sticking my hands into an awake Chihuahua. Well, this dog was not nice. What? Go figure. A mean Chihuahua? What? So normally when you have an aggressive animal, you try and put them into a lower cage and you leave the leash on. And that way you can leave the leash kind of hanging out. And that way when I, as the technician that needs to anesthetize this animal, I don't have to reach in to get it. I can just kind of drag him out by his leash and then do what I need to do. Well, somebody had taken the leash off and put him in a small up cage. So the cage is small, square, and it's like a tunnel. And he is in the back of the cage snapping at me with this pus-filled mouth. And the only way I can get him is by reaching in like this, and now he's attacking me. So I did not want him to be attacking me. So I grabbed the rabies pole. You guys are going to learn how to do the catch pull. And the way that you do it is you loop it, right? You loop it under one arm and then over the shoulder so that I'm not choking him. I don't want to choke him. I don't want to hurt him. He's scared. He's terrified. He's not trying to hurt me. He's trying to get away. He's trying to tell me I'm terrified of you. I think you might hurt me. Please leave me alone. And I empathize with that. So I go to loop him. Thank goodness there was another technician in the back with me helping me because she was my witness. Well, he bit the pole. He attacked the pole, and the pole is metal. So I'm like, oh, you little so-and-so. So I finally looped him, and I pull him out, and I put him into a plastic box called an induction chamber. And basically what we do is we fill it up with gas. I put him to sleep. I don't have to touch him again. I'm not going to try and give an injection to this dog. Well, his mouth was bleeding a little bit. Well, he has terrible dental disease, and he just bit a metal rabies pole. So I get him down, get him anesthetized. I'm going to go put a tube into his throat. What kind of tube am I doing? And not so much an otomy, because I'm not making a hole. I'm going to do an endotracheal tube, or a tube inside the trachea. So the way that I do it, there's a couple of different methods, and we're going to teach you. This is something you have to do. Usually you have someone holding the mouth open for you, and then you grab the tongue, and you can kind of manipulate, get it past the vocal cords, and set it in. I was the only surgery tech, so I had to use this like one-handed technique. So I click my finger up behind the upper canines, pull the tongue out like this, and now I can manipulate the head, and I can get it down in there. So I go to intubate, and the poor dog, his whole jaw, when I lifted up the head, just went plug. And I was like, oh no, oh dear. So I rush in on, hey doc, this dog's jaw is toast. But he's like, what? What did you do? I'm like, I did nothing, I promise. So he comes over, and when the dog had bitten down, the disease had actually eaten away the mandible. The mandible bone, jawbone itself had been eaten away. And when he bit down, it was so thin that it just broke. And he had a break here, and he had a break here, and he had a break here. And when we took radiographs, instead of, now obviously this is a horse. Here's the dog. Instead of this nice, thick, white, pretty bone, he had about that much. He had a tiny sliver of bone here at the bottom. Everything else had been eaten away. So we transported him to the dental specialist. Yes, there is a dental specialist for animals. So just over here off Fondren. And I guess they fixed it. There was no way we could plate it. There's no way we could fix it. So yeah, amphiarthrosis, really
You're
slightly
cutting off.
movable. I'm cutting off. Let me check. Oh, my internet. My internet looks okay. Am I back? Can you hear me now? Okay.
Yeah, you're back.
Perfect. All right, so another place that we have this amphiarthrosis joint is in the pelvis. And I don't have my pelvis in here. I think it's over in another room with Ms. Rivera. But right at the point of the pubis, we have this slightly movable joint. And again, it's so I don't break my pelvis every time I put pressure on one side. Here's the other crazy thing. Those of you that have children, oh my goodness gracious, you are so brave. You are so brave. Because guys, here's what happens, believe it or not, but believe it. Your pelvis is broken when you give birth. I know, right? So we have this symphysis, or not symphysis, yeah, symphysis, this amphiarthrosis joint in the pubis. When the baby's coming out, you have these muscles that pull the pelvis apart and separate and break that joint, giving room for the baby to come out. Your pelvis breaks. Just another reason why circle / baby. Babies are awful. Finally, we have a freely movable joint. We have our diarthrosis joint. This is going to be freely movable. Show me an example of a diarthrosis joint. Yes, all of the above. You have here, all of these skeletal mobile muscles. So we have, once more, synarthrosis is no movement. Amphiarthrosis has cartilage, slight movement. Diarthrosis is a synovial joint, freely movable. It's important that you know these three terms, and it's important that you know what glue is holding them together. The glue here is fibrous, the glue here is cartilaginous, and the glue here is synovial. All right, so we have some types of joints, and these are named by the movement that they do. A hinge joint. Think of a door opening and closing. It only moves in one direction. An example of your hinge joint would be your elbow. This is the only movement my elbow can do. I can't go side to side. I can't go the opposite way back. I can close the door. I can open the door. I can close the door. I can open the door. So this is called a hinge joint. The next one is ball and socket. Someone tell me an example of where you have a ball and socket. We talked about two of them just yesterday. Your hip, where your femur articulates with your pelvis. Tell me the other one. Your shoulders, where your scapula articulates with your humerus at the glenoid cavity. I'm using these words. Do you guys remember from yesterday? So ball and socket, there's a ball, there's the socket, and it rotates like this, and it's what allows me to have a pretty free range of motion. My gliding joint, this is what allows one bone to kind of glide and slide over another. My carpus, my tarsus is an example. I have two layers of bone. Your carpus is in fact 6 bones, and it only does limited movement. Now I can do this, but then this, pretty limited. So these bones, and you can feel it, especially if you're a little older, you have a little bit of arthritis. If you hold your arm to keep your arm steady, because oftentimes we're like, look at how much I'm moving my wrist. No, you're not. Let's keep our arms stable. And you can feel your forearms working. And if you just rotate it, you may feel it click, click, click. Those are those little bones rubbing and sliding over each other. So those sliding, they're called gliding joints. You have a pivot where one bone pivots around a stationary bone. A great example of this is the first two cervical vertebrae, atlas and axis. Pivot, pivot, pivot. It's this pivot joint that we watch in horses. Do I have any equine people? Equine. So you know that you watch the bob of the head to check for the gait of the horse, because their head bob, as a horse walks, their pivot joint moves in tandem with their gait. If they're lame or if they're experiencing some pain in a foot, their head bob will be off. So that's what we're watching for, is that pivot joint in our equines when they're walking. A condyloid joint, wow, I didn't say that very well. Condyloid, one bone fits into a shallow depression. A great example of this would be the patella. Here, this is the caudal or lower end of my femur. And right here I have a shallow depression. Everyone can see that. Where this would be on me is right here. Right here. So my femur coming down right here in this depression, that's where my patella sits. Does anyone in here have a condition called luxating patella? What a luxating is very common in our small breed dogs, especially our poodles. This is too shallow, and my patella slips out and is not contained properly.
My Chihuahua has it.
Do what?
My Chihuahua has
Chihuahua?
it.
So does Poppy. Poppy has it. So for those of you in TV land, this is the distal end of my femur, right? It's gonna be down where my knee is. Right here, you can see there's our shallow groove right here. And right here is where the patella sits. And it's these two edges that keep the patella right in place. Condyloid joint. Finally, we have our saddle joint. These are going to be where we have a concave and a convex. It's called a saddle because think of how a saddle starts and then it goes down like an easy chair. We have both concave and complex, concave and convex, not complex. Because a saddle kind of dips. Example of that is your thumb. In our animals, it would be the dew claw. So those are our different types of joints. Hinge, ball and socket, gliding, pivot, condyloid, and our saddle. There's just another, there's a picture for you. We have a connective tissue that joins bones to bones. I don't think she mentioned that, but before we get into the types of movement, just in case, we have a tissue that joins a bone to a bone. Tell me what this tissue is called. Nice, a ligament. The way that I remember that is when I am spelling the word ligament. I can't do it. I don't have my. Anyway, just like we did with the word ilium, the beginning of the word ligament, turn the L into a little bone. That reminds me bone to bone. Because I have another type of connective tissue that connects muscles to bones. Which would be what? Tendons. All right, so here's what I want to do for a second. I want to play with your fingers. I want to demonstrate how the muscles manipulate the ligaments and those manipulate your fingers. This is just for fun. So our fingers are capable of pretty great dexterity. We can, for the most part, move them independently. Some of them, you can see, can't just move my ring finger. Some of you can. If you, this is where it gets crazy. So we are put together like puppets, right? These muscles are manipulating this. These muscles manipulate this. These muscles manipulate this. So if you, again, hang on, put your hand around, and now do some pretty exaggerated motion with your fingers like this. And you'll feel that forearm muscle kind of squirming and worming under your hand. So what we've got are these ligaments. So these muscles here have ligaments here. And as the muscle contracts here, it pulls. And then when these muscles contract, it pulls. So these are the muscles that close my hand. These are the muscles that open my hand. Now here's what we're going to do. We're going to play with our ligaments for a second. Because you can overextend. These ligaments are like rubber bands. And you can, in fact, overextend them to the point where they will no longer work. I'm not going to hurt you. You guys in the TV audience, I'll get a little closer to the camera. We were just touching and moving and feeling our forearm. So what we're going to do now, we're not going to hurt you. I'm not going to hurt you. This is not permanent. The first thing we're going to do is we're going to play with the strength of that ligament. So I want everyone, give me a virtual high five. And now what you're going to do, so virtual high five, and now what you're going to do is make bear claw. We made bear claw. And I want you to feel how stable the tips of your fingers are. And they're pretty stable, right? All right, so now what we're going to do is we're going to relax. Now what we're going to do is we are going to hyperextend or overextend one of these ligaments. And you're going to lose control of part of your finger. I promise, it's tough. So we're going to take, which phalange? The third. The third. The third. We're going to take that, and the way that we're going to hyperextend it is we're going to drop it and no others. You have hyperextended that ligament. You no longer have control of the tip of your finger. If you look, it's just floppy. I have hyperextended that, and I no longer have control. It's crazy, right? You can't. You can't, because what you've actually done is we have a broad ligament that also helps called aponeurosis. She'll talk about that later. But you've overextended it. If the strings are overextended, they don't move the part. So now everybody can play with dead fingers. And it does, and it will work. It works best with the third. But if you try it, because I have trouble with this one, it works with every finger. You can do it with all your fingers. Yeah.
I seen one where you the same one you did where you have your middle finger down, but I seen one where you put it on the table and you try to lift your ring finger, it won't move.
Oh.
So like if you put it on the table or like put it on the board, it's the same thing.
Yeah.
And then try and lift your ring finger.
So here,
And then bend your middle finger.
I can lift it, no problem. Bend it.
It's like impossible.
Yeah, that's a good one. I'm going to take that one too. So just a nice demonstration of how this all ties together. All right, so moving back to our joints, our types of movements. To flex. Show me a flex. Boom. To flex means you're bending the joint. You are decreasing the angle between the two bones. I remember it because the first thing that I said when I said flex, everybody did this. So you're moving two bones closer together, you're decreasing the angle, you are flexing the muscle. Now from flex, show me what extend would look like. There you go. We are increasing the angle between the two bones. Straightening the joint. Bending, flex, extending, extension. Abduction and adduction. Abduction means to move away from the body. Adduction, towards. Did Ms. Rivera teach you the AD trick to ab and add? Oh, then I will show you a trick of ab and add to help remember. I gotta do this so that I have my. Actually. All right, so we have ab and add. One means away from, one means towards. If I look at the letter B, what direction is it facing in relation to the A? And when I look at the letter D, what direction is it facing in relation to the A? What does ab mean? Add. There you go. So that's a nice, easy way to remember.
That would have been helpful like 2 or 3 weeks ago.
So now we can just look at the word and we know abduction, away, add, towards. And then finally, move this thing. We have circumduction. What does circum mean?
Around.
It means around. So show me a circumduction movement. Here. Here. That would be circumduction, moving it in a circle. Picture. Oops. This is just a picture of the movements. All right, comments, questions, concerns? Yes.
I wanted to ask, what happens whenever you tear your ACL?
All right, so your knee joint, the question was, what happens when you tear your ACL?
It's painful.
All right, so your knee joint, very complex. Here I have the distal end of my femur. There's the proximal end of my tibia, my fibula, my patella. There's a lot of crap going on here. I have got ligaments, so I've got 2 ligaments around the back. Okay, they're going to look like I'm drawing them on the front, but think of them around the back. And they are called, actually, crisscross applesauce. And then I have another ligament here and another ligament here. And what these ligaments are preventing, if this is my knee, they're preventing my knee from doing this, and they're preventing my knee from doing this. The cruciate ligament that helps to prevent, when I'm running, this is really common in large dogs. I'm running, and I stop. The momentum of my body keeps going, and my knee goes, and it pops all of those connective tissues. That's what we mean when we say ACL. ACL is the anterior cruciate ligament.
Can you break it twice?
Of course you can, yes.
She broke it twice. My kid used to say after she was running and there was a hole, and my husband told her.
Yeah,
Popped out completely.
it's kind of like, so when you repair the ACL, think of, you now have a rubber band. I've given you a rubber band, that's your ACL. And the rubber band breaks. We've all had it happen. So you try and tie a knot in the rubber band. Is it ever the same? That's an ACL repair.
Yeah. So,
Tying a knot in the rubber band.
so what happens? Because I was told whenever I tore my ACL that I didn't need surgery for it. It was optional. But if I wanted to keep playing or doing activities, I had to.
You most likely then did. So the question was, she was told that surgery was optional. You partially tore it. And with rest, it can repair, but will be much more likely to tear fully in the future. So you most likely did not tear it all the way. You had a partial ACL tear. And it healed on its own, but is now weaker and more likely to tear all the way if you continue that same activity.
Yeah, my husband broke it completely. So I had to get screwed.
Yeah. That's crazy. All right. I thought I may have to excuse myself for just a minute because we do have about 15 minutes. And I'm not sure. All right, so here's what we're doing. We've now finished up the skeletal system. And Ms. Rivera has informed me that you guys will be having a skeletal system exam on Moodle. And it will open, I think I announced this, it will open tomorrow at 3 and it will close on Saturday at 7 a.m. As far as for anatomy and physiology, we are going to be finishing up the cell chapter 3 tomorrow, but I'm not going to schedule your test until Monday because I know you already have one test over the weekend. You guys are looking a little dead-eyed to me right now. You are. So I don't want to give you a second test over the weekend. So tomorrow when we finish up the chapter, we are going to continue on to the next. But we are going to have a chapter 3 test over the anatomy of the cell. Probably schedule that Monday. Give you guys a little bit of a break over the weekend. So I don't want to overwhelm you. So in midterm though, now that we finished the skeletal system, now we're going to talk about the muscular system. You can't really talk about one without talking about the other. So the muscular system is the tissues that attach to our skeletal system. The skeletal system gives it the support to ratchet against and provide movement. If you think about, again, that rubber band, I don't have a rubber band. I wish I did have a rubber band. And I do not have a rubber band. That's okay. I'm going to pretend that I have a rubber band. So I have this rubber band right here. Does everybody see it? So with this rubber band, right now, if I just set this rubber band, see, here's my rubber band. Oh, I'm not sharing this yet, am I? That would be helpful, wouldn't it? All right, so I have my rubber band. So if I set this rubber band down on my computer and it doesn't have anything to ratchet against, how well is it moving right now? It's not. If I pick up this rubber band and I only have one attachment, how do I have very much movement? However, if I take this rubber band, I now have two solid attachments. Now what kind of energy do I have? Got a lot. So that's where our muscles and our bones are working together to provide the movement. This is a cow, bovine, heavily muscled. We are now using artificial called somatotropin, which is a growth hormone that we use to manipulate the growth of these cows. This is the layman's term for this is a double muscled cow. There's a lot of controversy about these guys. Yeah, we do eat these cows. The idea is that I get twice the amount of meat, but I only have to feed them for the amount of one cow. So I'm getting 2 cows worth of meat for 1 cow. The problem is that this growth hormone, I'm in eating it. So we will talk about that. I'm not even getting on that soapbox right now. All right, so we have tendons. Tendons are strong muscles. We just talked about these. We played with them, kind of a preemptive to this. These are going to attach muscles to bones. So I have a tendon that attaches my bicep to my lower forearm. If you want to go down a really disgusting rabbit hole, this one's crazy. Go on the YouTube and look up torn bicep. Because these bodybuilders that are like, well, what's happening is I have 2 attachment points. I have a movable and a stabilizer. Problem is that they're lifting too much and they rip that off and their muscle just goes bloop. It's so gross. It's so gross. It's such a fun rabbit hole to go down though. It's kind of gross. And try not to go every time it happens. We have the insertion and the origin, which is what I just described. The more stable, the anchor of the muscle is the origin. The movable end of the muscle is known as the insertion. Give you guys a minute. Yeah, muscles are pretty amazing. What is the medical term for muscle, by the way? Myo. What would it be if I had pain in my muscle. Myalgia. Here's a term you've heard a bazillion times on TV. What would the term be for pain, not inflammation, pain in a muscle fiber? Fibromyalgia. Yep, fibromyalgia. Bear, your study buddy is the most adorable thing ever. Look at that face. Look at that little naked baby. His little fat chubby cheeks. Okay, I'm not crazy about children, but Bear, that kid's pretty cute. Gotta admit, the kid's pretty cute. It's your son?
Yeah, this is my son. My daughter, they both, like, if I brought her over here, they both have really fat cheeks.
Love it. What's his name?
Xander.
Xander. He's very cute. All I saw was this little tuft of hair. I didn't know what it was. He's very cute. What a good baby. A lot of babies are just, look at that. Oh my God. Future vet tech right there. We're teaching him up young. These are the formative brain forming years, and he's hearing all of these terms. He's gonna be a vet tech prodigy. He's gonna come in and he's gonna know everything there is to know and just not know how he knows, because we all taught him when he was an infant.
And he's got 2 dogs, so.
Yeah,
And
look at this. Prodigy. All right, so like we were just playing with our hands, I have strings that attach from this muscle to my fingers. Here I am attaching by ligaments, bone to bone to bone. But here and here, I am attaching by tendon. Now, I don't have individual, at least in the palm of my hand, individual strings. What I have is a very broad connective tissue called the aponeurosis. And the aponeurosis, it's just, if I had individual, every time I relaxed it, those strings, just think about what happens when you relax the string on a puppet. And the string just kind of coils on the floor. What this aponeurosis does is just keep everything nice and neat, and nothing gets tangled up, and everything works just fine. So this aponeurosis, you've got one here in the palm of your hand, you've got another one in the bottom of your foot. It's just a wide tendon. You can see it actually here in my foot. There's the bottom of my foot. And you can see here, it's just that wide connective tissue. Keeps everything nice and organized. Everything about the body should be nice and neat and organized. All of these tendons have a sheath. And what a sheath is just a covering or a coating. And what this sheath does is help prevent tendons from getting tangled up in other tendons. Every one of them is in its own little covering. If you think about these cords right now, I have a lot of cords up here. I got cord, I got cord, I got cord. And each of these cords, if I open up this plastic, it's a bunch of wires, right? And they're all bundled together. This is the example of one tendon. But if I didn't have these coverings, these coatings, these filaments, these little wires would all get tangled up with each other. Oh, sorry. I don't know what to do about that.
I don't know, going in and out for me.
Oh, that's because my internet left. My internet went away. All right. Am I back? Can you hear me? How's that? Oh, now I'm,
I think it's back to normal.
there we go. How's that? Okay. So what I was saying is these wires in each of these cords represents your tendon, and the plastic, this rubber coating, is an example of what a tendon sheath is. It just keeps everything nice and neat and organized. That was weird. The internet just was like, yep, nope. These tendon sheaths also help where the tendon pulls over a joint. Gonna help keep it taut, keep it from getting pinched inside the joint when we move it. If I have a big tendon right here, what I don't want to have happen is I open the joint, I close the joint. I open the joint, I close the joint. When I close this joint, I don't want it getting pinched in between these bones. And so the tendon sheath helps it move smoothly over those bones in the joints. And we have our ligaments. Ligaments are attaching bone to bone. We did our preemptive, played with our fingers, played with our ligaments. These can aid or restrict motion. We talked about the ACL, which is going to restrict motion. We talked about our digital or our phalange ligaments, which help to promote motion. All right, time flies when we are having fun. Do I have any comments, questions, concerns so far? Everybody's okay? We're going to pick it up here on tomorrow. I might have a kind of a cool video to show you to demonstrate tendons and ligaments. Otherwise, so for tomorrow, because we are going to all be on Zoom, tomorrow we're going to do the same thing. Enter into the anatomy Zoom code, and then I'm just going to leave the class open, and then we'll continue on with the midterm class. So we don't have to create a new Zoom code. You have enough Zoom codes to keep track of. All right, live studio audience, I'll see you tomorrow on TV. TV audience, I will see you tomorrow, and we'll continue on. Have a wonderful day.